Hi, I'm Dr. Don Bonner with Personalized Wellness. We're celebrating Labor Day today, so we're casual. The office is closed. As you can see, I'm casual. I just wanted to shoot a quick video today. I guess it's going to be quick, but I wanted to address, I keep getting, since I've, started this practice where I'm seeing patients and working with lifestyle medicine and wellness, that basically, I get attacked quite a bit from other physicians and institutions here in the state. I'll just leave it at that. But, it's this idea about medicine. I don't really look at what I do here at the clinic as really practicing medicine in the traditional sense at all. What we're doing here is what I would consider wellness, getting people well and well long term, and not relying on medicines. I think there's a big distinction there, and essentially what I do is I basically educate patients on certain things like diet, nutrition, what I call lifestyle, factors. I'm going to give a good example, what I think is a good example, and I'm going to use me as an example for basically what we do and what happens with medicine. So I was diagnosed 4 or 5 years ago with a autoimmune condition, autoimmune mediated condition that affects the neuromuscular system in my body, as well as the autonomic nervous system of my body. And fortunately, I had a really good doctor here locally that was able to make that diagnosis. But again, this was an autoimmune type of a problem. And you can say, well, was I genetically, going to have this problem from the time I was born? And I would say that where we're at now with that is that genetically I had a proclivity for being able to contract this sort of an issue. But really what this all was predicated on was epigenetic factors or lifestyle factors or environmental factors that basically brought on this problem. So what do I mean by epigenetic? So epigenetic. Okay, so we're talking epigenetics here. Okay, so epigenetics means the environment affecting your genes. So essentially I was a fully, full-time practicing anesthesiologist. So I was working long hours. So we can say there was definitely stress involved to bring about this problem. I would say poor sleep. We were on call quite a bit, so I had, periods of time where I didn't sleep very well. So obviously that was an issue. Diet, eating a lot at the hospital, making poor choices as far as diet goes. So that was definitely part of it. Exercise. I tried to exercise, but you were working so many hours that that wasn't always adequate. So basically, all of these things combined epigenetically brought about the issues that I was having. So what we had to do, or what I had to do, was basically learn how to handle and deal with all of these different issues to try to get myself back in better health. I did have to take some medication, still have to take some medication, but the idea of this kind of medicine is to try to utilize these lifestyle issues to bring about change and to get you well or get you better. So our goal here at the clinic is to address these issues. And, so I would say diet's probably the first thing we address. And We go to a moderate carbohydrate diet. It's pretty typical. And we do a lot of fasting protocols here at the clinic. I'm a big advocate in fasting protocols. So that's going to be one of the first things we do. We address sleep heavily. So obstructive sleep apnea, we try to make that diagnosis. We try to get our patients sleeping at least 8 hours a night. Very, very important. Stress management. Again, very important. Who doesn't have stress? So we try to, give our patients means of coping with that, meditation, yoga. We'll use certain adaptogenic supplements and herbs to try to decrease cortisol levels. And then exercise. And we'll prescribe an exercise program that is appropriate for that particular patient. That's some of the basics that we do. I would also say that supplements are very, very important. I would say all of my patients are magnesium deficient. Everybody gets magnesium. B vitamins, super important. Again, everybody's deficient. Vitamin D3, we check those levels. Again, everybody's deficient. And then I would say from there, we'll get a little more specialized. If we need to do with stress, we'll use some supplements, for stress modulation. For energy, we may use an amino acid supplement, CoQ10. There's a lot of supplements that we will use. I would say these are the basics for most patients, plus a probiotic. I think nearly everybody needs a probiotic. And then again, what we'll do is we'll supplement with different things depending on how the patient, presents to us in the clinic. But that's really what the biggest things that we do here in the clinic, and that's what I look at. And our goal is, frankly, to get patients off as many medications as we can. And we can do that by tackling these lifestyle issues and really looking at epigenetic issues. Okay, so I'm Dr. Don Bonner with Personalized Wellness. I'm kind of giving you an overview of what we do, and I think there's some confusion about that out there as far as what this kind of practice is and what our goals are here at the clinic. So that's about it, and give us a call. We'd be happy to talk to you. We'd be happy to start working on these issues with you, and look at a lot of these videos that I've shot, because a lot of these things you can do on your own. I would say that 95% of health are these issues right here: diet, nutrition, sleep, stress management, exercise, appropriate supplementation. If you can zero in on those things and get those dialed in, that's 95% of health. And that's what we're here for, to get people healthy, get people feeling better, and to be well. So again, Dr. Don Bonner with Personalized Wellness. Thank you.